So hi there, I'm Jennifer Smith. I'm the Medicaid program trainer, and we're just going to go around and introduce ourselves here in the room and online.
I'm Jamal Furkan, policy analyst with the Oregon Health Authority.
And Chris, do we have you out there? Go ahead.
We do. This is Chris Carrera, and I am the Improvement and Implementation Manager at the Transformation Center with the Oregon Health Authority.
Wonderful. Okay, so we're here to talk about Comprehensive Primary Care Plus, also known as CPC Plus, and this is information for clinics who have been approved for the program. So I'll give you a little bit of CPC Plus overview. We'll talk about Medicaid provider enrollment, Medicaid being the Oregon Health Plan. We'll also talk about the MMIS provider web portal. That is our Medicaid providers portal into information within our Medicaid management information system. We'll discuss the patient list template and how to fill that out and upload it on the provider web portal. We'll also talk briefly about enrollment and error reports and some next steps for you and what to expect from here on out. So we'll begin with a little bit of an overview on CPC Plus. Some of the background here: primary care has been underfunded. The individual payer model, it's not providing enough sustainable, flexible funding to really transform primary care, and that's where CPC Plus comes in. It is a collaborative effort between multiple healthcare payers rather than individual payers and CMS. To improve primary care and delivery. The Oregon CPC Plus program is a 5-year advanced primary care medical home model, and it begins on January 1st of 2017. It is regionally based, that way we can meet the diverse needs of primary care practices. And it is, again, designed as a multi-payer payment model. And that gives practices greater financial resources and flexibility so that they can invest to improve quality and efficiency of care and reduce unnecessary healthcare utilization. Currently in Oregon, we have 159 participating clinics. And these clinics are carrying out 5 functions of care delivery transformation. Access and continuity, care management, comprehensiveness and coordination, patient and caregiver engagement, and planned care and population health. You'll see there's a link at the bottom of the page there, and you will be able to look up more information about these 5 functions of care delivery transformation. And then just a little bit about providers. We have 2 different tracks. So each provider is recognized by CMS as either Track 1 or Track 2. So Track 1 is really the practices that are ready to build the capabilities to deliver comprehensive primary care. And then Track 2 is just a little bit more advanced than that. These providers are ready to increase the comprehensiveness of care through enhanced health IT, improving care of patients with complex needs, and using inventory of resources and supports to meet the patient's psychosocial needs. And this is taken directly from a presentation by CMS. So just to give you a little bit more detail, I know it's a little bit fuzzy. It really is just a copy of something that they put together. Just to give you the Track 1 and Track 2 and kind of explain that Track 2 includes the same elements of Track 1, but it goes beyond Track 1. So if you are, excuse me, as far as access and continuity, care management, those are the 5 things that we just talked about. And if you're Track 1, then you're in this first column over here where you've got your 24/7 patient access, you've got assigned care teams, short-term targeted proactive relationship-based care management. That was a mouthful. But anyway, you're in this first blue column here. Now, if you're in Track 2, then you are completing all of these things in both of the blue columns. All right, so I'm going to pause and take a couple of questions. It looks like we have a few. Our first question, how does this program relate to programs in place by our CCO partners? Do you have that one, Jamal or Chris? That might be something we would need to take back, but we'll find out here.
Yeah, this is Chris Carrera, so that's an excellent question. So the conversations specifically about which metrics will be selected for Oregon, those conversations are still in progress, so we don't have a finalized answer for you, but that question is being answered, and certainly one of those goals is to align them as much as possible with existing metrics. But we'll be getting back to the practices specifically on which metrics in the near future.
All right, wonderful. Thank you, Chris. Okay, so is the Oregon CPC Plus in addition to the CMS CPC Plus? Are we able to do both models? That's a good question. It reminds me a little bit of this. Sure. Is the Oregon CPC Plus in addition to the CMS CPC Plus? Are we able to do both models, or is it like a one or the other kind of deal?
I'm not 100% sure I understand the question. There may be a nuance I'm missing, so I'll take a stab at it. But if that's not the question being asked, then feel free to clarify. But the kind of the national CMS CPC Plus is managed by CMS, but then states or regions apply to that national level and then participate as their own region within that larger national structure. Is that what you're getting at, or are you asking a different question?
Yeah, this is Jamal. Chris, I believe that that's what the question's getting at, and so I believe that it is fully anticipated that clinics will be able to participate with multiple different regional and national payers. So if there's CMS that has the model, and we'll actually be using some of the metrics that are reported to CMS within the Oregon model. So yes, that is okay to do both, and there may be other payers within Oregon that have additional CPC Plus models to roll out for your clinics.
Okay, so next question, if we applied for the Care Oregon Medical Home PMPM and then were approved for CPC Plus, is it the same or different?
Yeah, and this is Jamal again. So that would be a different alternative payment methodology and per member per month reimbursement. The CPC Plus per member per month payments that we're discussing today are strictly for the fee-for-service open card Oregon Health Plan members. So those are the members that are outside of a CCO or managed care plan, whereas I believe that per member per month reimbursement for Care Oregon members would be members enrolled in a CCO. So that is okay to do both, as it would be for two different Oregon Health Plan populations.
Okay, so just to follow up on the question where we were talking about the state or the federal CMS plan or model, we have been approved by CMS for Track 2 and wondering if we will get OHA money plus CMS money.
So that, I believe, is possible. So for your open card fee-for-service Oregon Health Plan members, the per member per month payments are available for clinics that upload a patient list through the provider web portal.
All right, very good. I'm going to go ahead and move on to the next section. Please continue to ask questions as we move throughout this. So becoming an Oregon Health Plan OHP provider, this is a little bit about Medicaid provider enrollment. I do realize that there are folks looking at this that already are enrolled as Medicaid providers, but we'll talk a little bit more about that. So first of all, CPC Plus providers must be Medicaid enrolled and have an NPI. I've got a couple of links in here. You'll see anything that's underlined in a lighter color, that's a link. So when you have the PDF document of this slideshow, you can click on those. So you can apply for or look up the NPI. Also apply for OHP enrollment. There is a website at the bottom of the page, and that is our provider enrollment here at the Oregon Health Plan. And you would be, if you're not already enrolled as a billing provider, you would want to enroll as a provider type 09. That's a billing provider. We do realize that we do have some clinics that are already enrolled, also some nurse practitioners, and some Indian Health Service providers that will not need to re-enroll with a type 09, and we'll talk a little bit more about that. It's also listed in the tip sheet very explicitly. So OHP provider enrollment online, there's an online process you can do on our MMIS provider web portal. You would also be able to otherwise submit appropriate OHP enrollment forms. I'll give you more information about that. If you have questions about the online process or any of the forms or what's required to turn in with those forms, any of the fields on the forms, then you would want to contact the OHP provider enrollment team. There's a phone number and an email address for them. And to get a little bit more specific here, oh, did I not list the, apparently I didn't. So on the tip sheet that you have in the webinar panel on the right side of your screen, and that I'm also going to email out to everyone, it actually lists the exact forms that you need. So I'm just going to go back to the previous page actually, and I'm going to show you how to find that online. I think that was kind of my point here. I'm going to go ahead and click on this link here for the provider enrollment page. And it tells you how to become an Oregon Health Plan provider. So you can see we've got the NPI information up here. If you want to enroll with the Oregon Health Authority, it tells you some information here. But if you just scroll down here, you'll see here are provider descriptions, the provider types that we're talking about, and it tells you the required forms for each provider type, and it has a link to each of those forms. So if you were needing to enroll as a billing provider, you could look it up under this drop-down menu here, and you could just find billing provider, clinic, group billing right there. If you click on that, that information is going to come up here. Here's your provider description, the provider type 09. That's really just an internal number for our MMIS. It's not something that you need to remember for the long term. It's just how we classify providers within our system. And then it shows you that you need these 4 forms. So you need the 3110, the 3972, 3974, and the 3975. And each of those is a link. So you would be able to click on that and link directly to that form. We also require the IRS letter. And this is just a letter confirming that you do have an EIN.
Yeah, and this is Jamal. So just a couple more specifics about why providers are required to enroll with Medicaid. So for CPC Plus practices that are selected to participate in this initiative, there's the opportunity to receive per member per month payments for your fee-for-service members. And so in order for us to generate those per member per month payments, we need to be able to assign each of those open card members to the specific CPC Plus practice that was selected for the initiative. So what we've found oftentimes is that organizations or clinics are already enrolled and billing through one Medicaid ID number, an NPI, but it's not linked back to the specific practice that was selected for CPC Plus, or maybe there's a Medicaid ID number that's being used for multiple organizations, but not necessarily the specific CPC Plus practice. So We do require that the individual CPC Plus practice that was selected is Medicaid enrolled, and if once you do get that Medicaid ID number, to go ahead and send me a follow-up email letting me know what that is so that we can update our records. And this, just to be clear, this won't necessarily change any of your existing billing practices. That new Medicaid ID number is simply to be able to upload a patient list and begin receiving the per member per month payments for your open card members.
All right, so just a couple of questions that are coming in right now. How can we find site NPIs to submit the Medicaid enrollment form? That would really just be coordination with the sites and obtaining that NPI from them directly. Also, I did get a comment that from the handouts that are on the side there that folks are not able to click on the links. So what I will do is I will make sure when I send that follow-up email to you after the presentation today, I'm going to include those handouts. I'm also going to, in the body of the email, I'll make sure that you have all the links that you need. And then next question, all of our providers are enrolled as Medicaid providers currently, but we were also asked to ensure our clinics are enrolled with Medicaid. Is this process different from the provider Medicaid enrollment? The process to enroll the practices is not clear at all. Yes, it's the same. It is Medicaid provider enrollment, the same exact thing. And I'm just showing you on the web page how to find that information. Next question. We utilize one NPI for our hospital, which includes several clinics. How do we associate one NPI with multiple clinics? You just include that NPI on the enrollment information. We do have lots of providers that do that, where they have multiple provider IDs with us that are all associated with the same national provider identifier. All right, very good. So I'm going to go ahead and move on. And again, if you have any provider enrollment questions, you can contact provider enrollment at this phone number and this email address listed right here. Okay, so MMIS provider web portal. So for anyone who does not already have access to the provider web portal, under the appropriate clinic, under the appropriate enrollment for CPC Plus approved clinics. So it has to be that location, that site, that has the access to the provider web portal. So this is just telling you how to get that access. Initial access requires an OHP issued PIN, and this happens, every newly enrolled provider receives this automatically. Our MMIS sends it directly to the mailing address associated with the provider file. And that PIN does expire within 90 days. So if you're a practice that has been enrolled with Medicaid for a long time but you never set up a provider web portal account, and that is the site that's approved for CPC Plus, then what we need you to do is contact Provider Services Unit, and they can replace that PIN for you. And then you would be able to follow this process. If you still need to complete the enrollment, as soon as the enrollment is done, you'll be sent that PIN automatically. So there's two different ways to get a PIN if you don't have access, dependent upon whether or not your CPC Plus site is already enrolled. And then at the bottom of the page here, there's a link to our provider web portal guides. There are handbooks and step-by-step guides on that page for almost anything you can do in the provider web portal. If you need to set up an account, you would begin at this website. And then on the account menu, you would click on Account Setup. You would want to have your PIN. You only need it just this once. You can discard it after you get your initial access. Your login ID is your Medicaid provider ID. And then you would use that PIN on that letter. And then click on Setup Account. And then you would just complete all of the fields. They are all required. The username cannot be the same as the clinic name or the contact name, exactly as it appears here. And you would just fill out all of the fields. Please know that the secret questions are, they don't allow special characters, so if you wanted to ask a question and put a question mark, it's not going to accept it, and that the answers are case sensitive. And that your password, you'll see some password requirements over here on the right. You need at least 8 characters, 1 uppercase, 1 lowercase letter, and a number or special character. The step that I always forget is this right over here, this little checkbox. Make sure you check on that because if you click submit without checking that box, then everything kind of clears out and you have to start over. So that's no fun. And then once you click on submit, then you should go to the home page of the provider web portal. So the account setup process is fairly easy. There's also ways to set up clerks in your office to be able to upload the patient lists, and we'll talk about that next. Okay, so clerk setup steps. The first thing you want to do is make sure that you're logged in under the correct provider ID. So that, again, is the CPC Plus approved site that you want to be logged in as, because you do want to upload all of your patient lists under that provider ID. You would select clerk maintenance from the account menu. You can add clerks where you would be setting up an account for someone else, or you can give access to someone who already has a provider web portal account. For example, if you hired someone that is a biller for some other clinic or was a biller for some other clinic, they're already in the provider web portal with a username, and you would be able to search for that person, and that way that person would be able to log in using the same login ID and password for their multiple clinics that they have access to. So that would be more convenient for them. And then you want to make sure when you're setting up these clerks, in order for them to be able to upload patient lists, there are 2 roles that they need to be assigned to, and that's PCPCH, that's the patient-centered primary care home, and the trade files. Those are the 2 roles that they definitely need, and then you would click submit. So I believe I go over this specifically, but that was just the steps so you have them all on one page. So here what you would do is you would, under the account menu, you would click on clerk maintenance. And this is what you would do if you have someone who's already assigned and you just need to assign them those additional roles, or if you have someone that you completely need to add. So it's all under clerk maintenance. This is a switch provider if needed, so if you have access to more than one provider ID under your login, again, you want to make sure that you are logged in under the CPC Plus practice. And we have a lot of provider numbers where they were what we refer to as rolled up providers, where they might have access to more than one provider ID under the same administrative login. So do make sure that you are logged in as the appropriate.
Yeah, and a quick note on that really quickly. So out of the 159 CPC Plus practices that were selected, I believe we were able to locate a site-specific Medicaid ID number for about 129 of the practices in total. So if you are curious as to what the Medicaid ID number is for the specific, for your specific CPC Plus practice, you can send us an email and we'd be happy to share that information and make sure that we're on the same page as to which of your Medicaid IDs patient list will be uploaded under.
All right, would that be an email to you, Jamal, or would that be an email to Provider Services Unit?
Yeah, that can come directly to me, and my contact information will be at the end of the slides here.
All right, very good. All right, so this is just how to switch provider if you happen to have more than one provider ID listed. So on the account menu, you would click Clerk Maintenance, and then you would click on Add Clerk. That's right down here at the bottom. You would enter the clerk's information. There's a couple of different ways you can do this. If this is a new clerk to the provider web portal, you would just give them a username and fill out this information for them. The password you give them, although it does have the same requirements as all the passwords in the provider web portal, it's temporary. They get to change that as soon as they log in for the first time. And you could also, if someone already has access to the provider web portal or they have had access in the past and they'd like to use the same username that they used before, you could click on search. That's right here. And you could search for them. You'll get a little pop-up menu and you'll be able to search for that person and find them. And once you click on them from that search panel, then some of this stuff doesn't come up because they maintain their account. So you don't have to actually fill out all of these things because they already have a password and they can get in through their account. But what you do is you do want to come down here to the roles area. You'll see the number 4 right here. And you want to select roles from the available section over here and move them over to the assigned section. Anything that's in the assigned section, that means that that clerk has access to do that under your provider ID that you're logged in as. And once you click on submit, they will have that access. So what I did here is I made sure that Johnny 5 has PC, PCH, and trade files as he would need for uploading patient lists under this provider ID.
Yeah, and just a little bit more information as to what each of these roles specifically do. So the trade files will allow the clerk to actually upload the 3131 patient list template. So that's kind of that batch enrollment process. The PCPCH role allows 2 different functions within the provider web portal. It allows clinics and the individual clerk to view the specific per member per month payments sent out for each of the members, either by the check number, the month that the payment was for, or by individual recipients. And then there's also a functionality under the PCPCH role for the clerk to view the complete roster that's already enrolled with the clinic. And along with that, the clinic is able to make manual adjustments to the roster, so end-date certain patients or add additional patients manually, kind of one by one, without having to go submit the actual patient list. So those are what those 2 roles actually do for each of the clerk profiles.
All right, thanks, Jamal. The next slide shows you how you would update someone. So maybe I realize that there are folks looking at this that already have a provider web portal account. They've already got clerks. And all you need to do is make sure that your clerks that are assigned to this work have these roles. So the next slide shows you how to update someone. So if you clicked on clerk maintenance under the account menu and you had your clerks already here and you just wanted to update, so we're going to update Eva to have PC, PCH, and trade files. So what you would do is you would click on Eva out of your clerk list that's available there, and she would come up, whoops, she would come up right here, and then you would choose PC, PCH, and trade files from the available roles and move them over to the assigned roles one by one, or if you hold down your control and click more than one, and then just use that single arrow. The double arrow will move all the roles to one side or the other. Just so you're aware of that. You probably want to stay away from that if you are updating someone, because you don't want to accidentally move everything over and then not know which ones they needed or didn't need. So once you have everything over in the assigned roles that you need, you would just click on Submit. All right, before we move on to the patient list, I just want to see what questions we have coming in. Okay, do you want me to ask? Okay. On 2 of our applications, we used brick and mortar address, which may have contained 2 suites. So we may have more than one Medicaid number. How would that work?
Yeah, so for those two different CPC Plus selected clinics at the same location but different suites within the building. Each of the individual suites would enroll as a Medicaid provider and have their own Medicaid ID to upload a patient list and receive per member per month payments.
All right, next question, and I'm so glad you asked. You mentioned a patient template. Where do we get this template? And that is coming up next. So we'll go ahead and move on into that segment. So here we are on the CPC Plus patient list, and we're going to talk about the template. That's the Form 3131, and uploading that list on the provider web portal. So your patient list is going to consist of any Medicaid members that you've served within the last 18 months. So if someone had an office visit 17 months ago, they're going to be on this list. They refer to that as the 18-month look back. So if you're familiar with that term, you will find the patient list on the OHP website. Again, it's the OHP 3131, and this is a link directly to our forms page, and you would be able to look for OHP 3131 under the list there. Your third step as far as patient list goes is you want to make sure you're filling out the form properly. So you're using only alphanumeric characters. You're reporting only 1 quarter at a time. And for each patient, you want to enter a capital Y in the closure column and a capital X in the ACA qualified column. And I'll show you a picture of that in just a minute, so that'll get a little bit more clear there. You also want to make sure you save the list as a CSV file. The provider web portal will only accept a CSV file for a patient list. And then step 5 would be uploading that list on the portal. So here's what the patient list template looks like. So once you find that, again, here's our link to the forms page right here. And I have an example of a filled out one as well. But you can see the closure right here. You want to make sure that's always a capital Y. And then your ACA qualified column, you want to make sure that's always a capital X.
Yeah, and we'll look at a example of a filled out template in a moment, but for the group type, that will kind of represent the program that you're operating under. So I believe that will be either CPC T1 for the Track 1 clinics or CPC T2 for the Track 2 clinics. The PMP ID field can always be left blank. In the past, that had been used for the plan ID or the CCO ID. So CCOs and managed care plans also have Medicaid ID numbers in our system. But again, that can be left blank. It doesn't need to be completed. And then the Oregon Medicaid ID, again, will be that 6 or 9 digit ID number that the clinic will get once they're enrolled with Oregon Medicaid. Having that Medicaid ID tells the system to enroll the particular client with your clinic's ID number. And then for the recipient or Oregon Health Plan members' information, it'll be their specific ID number, their date of birth, their last name and then first name, and then their middle initial. So that middle initial can actually be left blank, or that can be filled in. But again, as you submit the patient list, you'll want to be sure to not include any non-alphanumeric characters. So you wouldn't want a period after a middle initial. You wouldn't want a dash for any hyphenated names or an apostrophe for any names. You need to remove all of those non-alphanumeric characters, as they would cause the entire patient list to reject. And then for the start and end date, if you've seen the patient in the prior 18 months, or if you've got a new patient that you've engaged during the quarter, go ahead and make the start date the beginning of the quarter and the end date the end of the quarter. So for quarter 1, 2017, you would upload a patient list that has start dates 1/1/2017, end date 3/31/2017. And then for the same patients that are still part of your medical home and had been engaged in the prior 18 months for the following quarter, so quarter 2, 2017, all of those members would have start date of April 1st, 2017, end date June 30th, 2017. So we do anticipate that clinics will upload one patient list per quarter. They won't be ongoing, and that's to allow for those members who may transition care to other primary care practices, or maybe they've moved to a different location in the state. That would allow that new primary care medical home to attribute that patient to them. So again, we expect clinics to upload one patient list at a time, consisting of the members they had engaged with in the prior 18 months. And as we go to the next slide here, there will be an actual filled out template for more information on that.
I also want to point out that when you pull up the patient list, that what comes up is, if you look at the bottom here, there's the PMPM template, and then there's a second sheet that has instructions. All right, let's go ahead and move on to our sample. So this is one that I have filled out and just kind of put it here so you can take a look at them. You can see that the group type is, just like Jamal said, CPC T2. That means that it's CPC track 2. And then there's T1 for track 1. The Oregon Medicaid ID is my 9-digit ID that I'm enrolled with Medicaid with. And then I have my client ID, which is an 8-digit alphanumeric ID. Date of birth. And I guess this is where you can put dashes in, or not dashes, but slashes for the dates. And then client name, we have last name and then first name. The third column would be for middle initials, but you can leave that out. And then we have our client start date and end date for the first quarter of 2017. And then closure has Y's all the way down, and ACA qualified has X's. Do remember that you only want to report 1 quarter per file, and the patient list will only upload in CSV format, so make sure you're saving it as that. All right, give me just a moment. I'm going to take a couple questions if we have them. Okay, so next question, are we including the managed care Medicaid members in the list, or only the open card or fee-for-service members?
Yeah, that's a great question. So while we're only issuing per member per month payments for open card members, the system would actually allow enrollment of any member who's got a Medicaid ID. So as you're crafting your patient list, you'll want to try to only enroll those members who are open card. But we understand that for Medicaid members, there sometimes is that churn of members moving in and out of a CCO to open card and back to a CCO at times. So if you're seeing that a lot, you don't necessarily need to manage all of that churn. You can enroll all of those members, and the system, as it generates per member per month payments, will know to only issue per member per month payments for the open card members at your practice.
All right, next question. When do we need to report the first quarter of 2017? So are there deadlines? Are there specific dates that they need to get those in for?
I don't believe that there's an actual deadline. So we are able to pay retroactively. So if a list comes in February for enrollments back to January 2017, we are able to make those payments retroactively. Maybe Chris Carrera at the Transformation Center can speak to this a little bit more, but I believe that there are some new standards related to PCPCH recognition that we are anticipating enrolling the practice under, because there are different levels of payments for the different tier that the clinic is recognized at. And so based on that recognition criteria, we'll be assigning the tier level to the clinic in the MMIS, which will factor into the actual payment amount that's issued for each member. So I think that over the next few weeks, we should have more information as to the timing of enrolling the patient list. We're actually in the process of establishing the provider web portal for this capability to operate the CPC Plus enrollments and payments. And so that may be delayed a little bit into January, and we'll certainly keep clinics posted on when we hit an official go live for being able to upload patient lists. But as it stated earlier, there will be a degree of retroactivity that's allowed in, if we're into February and even March, there's the ability to retroactively enroll a patient list back to January 2017.
All right, the next question is there a deadline to get Medicaid enrollment completed for the clinics that are not currently enrolled?
Not at this time, no.
All right, so let's talk about uploading that list. You would select the upload from the trade files menu, the upload option. And then from there, you want to choose your transaction type. There's a drop-down menu here. You want to choose the PMPM enrollment file. Once you do that, you would select Browse, and you would find that CSV file on your computer and go ahead and upload that. You can choose to type something into the Save As file name or just let it autofill. And then you would select Upload.
A quick note on the file name. I believe that the file name can't be more than 50 characters. Otherwise, it would reject the upload. So just a note on that.
And then once you click on Upload, you'll see down here that uploaded files will be listed here. And you'll also see once you click on Upload that you'll get an informational message here that the upload was successful. If you get another message, then it likely did not go through. So you might want to try that again, and if you continue to have trouble, that's something that our provider enrollment, or I'm sorry, our provider services unit would be able to help with, right, Jamal? Okay. And then once you've uploaded your list, a report on either acceptance or rejection of the list is sent automatically to the administrator on the provider web portal account. The administrator is the person that initially set up the account. Unless someone has gone in and changed that information, it's going to be that person that set up the account. So if you need to change your provider web portal administrator, that can be done through our provider services unit. And they can also tell you who your current administrator is. So if you're not sure, maybe you've had a provider web portal account for 8 years and you have no idea who the administrator is. You can contact provider services and they can tell you exactly who that is. They can also change it if it needs to be a different person at this point.
Yeah, and as it relates to the patient list, so when you upload the patient list and it says uploaded successfully, that doesn't necessarily mean in and of itself that it's been accepted and the members are enrolled. What happens is the patient list uploads to the system, and then there's a capitation cycle that runs every night, every weeknight at about 6 p.m. And so when it's uploaded successfully, it's uploaded to a queue, And then the MMIS, during that nightly cycle, will take that patient list and determine if it meets the formatting requirements to be successfully enrolled from the upload. And so that's what will be sent to that MMIS administrator account the following day. Was based on the upload, was it successfully accepted and enrolled, or was it rejected, and what was the reason that it was rejected? So the following morning, typically that MMIS administrator, if it is rejected, would get that note at the bottom of the login screen that says the patient list was rejected because of a non-alphanumeric character, or the patient list was rejected because there were an incorrect amount of columns in the template, something of that nature, or the PMPM group type didn't match the program that the providers enrolled for. Aspects like that could cause the entire patient list to reject. So it's important to pay attention to that message. And then on the actual enrollment report, so if the patient list is accepted, so uploaded successfully, accepted, meaning that it passes all of the formatting requirements, then we're going to send you a enrollment report which tells you which happened with each of the members. So there are situations where individual members on the patient list can be rejected. For instance, if their Medicaid ID number or prime number doesn't match the record in MMIS, or the system's not able to find that member in the MMIS records. Aspects like that could cause individual patients to reject, and that report that we follow up with the following day that we'll kind of manually send out to the contacts will detail patient by patient if they were enrolled successfully or rejected and the reason why.
All right, so the first bullet there, just for my own clarification too, is a message, not necessarily a report. It's a banner message on the front page.
Right.
Okay, very good. So as soon as you log into the provider web portal, the page that it takes you to before you select anything on the menu is the front page, or called the providers page. You'll hear it called different things, but it has your provider ID that you're logged in under listed on the left side, and then right under that you've got some banner messages. So that's where this acceptance or rejection will show up. Awesome. Thank you, Jamal.
Mm-hmm.
All right, so we're nearing the end here. We're going to give you some resources and upcoming training topics. So we do have another session. You do not have to register for the second session. You're already registered because it was just one registration. So you'll get some reminders in your inbox if you were registered for this one. You'll get the reminders for the January one as well. So here are just a few links. We've got the CPC Plus information from CMS. Also OHP forms and publications, and the MMIS provider web portal. And then here are some contacts for you. This is Jamal's contact information, and you would want to contact him for patient list, enrollment, and payment questions. And for any training questions, you can contact me at that medicaid.providertraining, or also my phone number there. And then more contacts. For any program questions, you can contact PCPCH. For provider web portal assistance, you want to contact the provider services unit. That includes any setup, switching the clerks on the provider web portal, any of that kind of stuff they can help you with. And for OHP enrollment assistance, you can contact our provider enrollment team. And then upcoming training, you don't want to miss the second session on January 18th, where we will talk a little bit more in detail about the OHA reports. And we'll also talk about electronic data interchange information, including the 820 payment report that you will receive for your members that are listed on your patient list, so for your per member per month payment. And then, of course, your questions. So make sure you bring any questions. Hopefully by January, you'll kind of be pulling some things together and you'll have a bunch of questions ready for us. So we want to dedicate some time to that as well. All right, and all of that being said, I want to go ahead and open it up for more questions here if you have them.